So Edgar asked me to talk about monitoring to assure a flex vaccination program success. And initially I thought, well, that's a pretty easy topic. We do this all the time. You know, it's just telling people what I do every day. And then the more I started asking people, you know, what would you expect from a talk that talked about monitoring? The expectations from different people from different areas were very vast and varied. So then I struggled to put everything into an outline in order to make it a cohesive presentation. So I put some ideas down on paper, and I came and I sat and talked to Edgar, and he looked at my ideas and said, oh, well, you're just using the PERS 5-step process. You start with figuring out what your goals are. You talk about what the current status of the system is. You understand what constraints you might have to implementing a vaccination program. You talk about what solution you might want to put in place or what options you have for solutions. And finally, you implement it and monitor it. And so all those steps make perfect sense. We've always talked about them with PERS. It's just ingrained in BI is the PERS 5-step process. But why can't all vaccine programs do that? So what I try to do is adapt the PERS 5-step process for vaccination programs. So all vaccination programs or health monitoring programs or health programs put in place in systems can follow this program or follow this list of 5 goals. So that's why the paper is laid out the way it is. It's laid out in the 5-step process because that's how I thought about it from beginning to end. What's the goal? What are we going to do about it? And then how do we know it's working at the end? What I did for the presentation was I kind of brought things down into 3 aspects of monitoring. So when I asked people about monitoring, I got these 3 kind of points. The first one is the program needed and appropriate? So how do we monitor a system to know that it needs this vaccine and that it's going to work and it's going to meet the goals of the system? The second one is all this compliance monitoring or understanding, is the vaccination being implemented as you intended? And so how do you, as Dr. Hendrickson would say, inspect what you expect? So more of the compliance, are they actually doing what you thought they were going to do? And then the last one, obviously, is how do you monitor to know the program's effective? So this was the biggie that I thought I started with, but then came back to these 3 different points. So the first one, is the program needed and is it appropriate for the situation? So this one takes into account the system's current goals and then the current status of the system, and then eventually looking at the constraints. So the first 3 steps of the 5-step process. So first you need to identify, is the infection present and when is the timing of infection? So I started with PCV2. So PCV2 itself, is the virus present? So I think it's pretty easy to determine if the virus is present in most places. And then, is it really causing disease? And so as circovirus came on board, as we know it today, we've all seen the clinical signs. You watch the pigs wasting, you can see the reduced growth rate. So knowing if you have circovirus was pretty easy back then. We also have previous diagnostic information. We could use histopath lesions. We can look with histopath lesions, clinical signs, the 2x mortality to see if we have PCVAD. This is kind of old news today in today's, at least the US market. But also estimating the timing of infection. We kind of do that with either serum PCRs to understand when is the critical onset of viremia in a population. We can do it with serum antibody tests, some with IFA, some people have used the ELISA just to estimate the timing of infection in a population. Some people have done it by understanding when are their peak clinical signs, when do I have diagnostic confirmation. But all of those things help us understand, is the virus present, is it causing disease, and when is it happening? Those are all important to setting up a program. In reference to Mycoplasma, we need to do the same thing. Is Mycoplasma present? Is it causing disease? So we can look at late finishing serology positives. If you have late finishing serology positive, you have Mycoplasma, okay. Do you have the dry non-productive cough? Do you have gross lesions? Do you have the histo lesions with PCR confirmation to know that it's causing disease? I can see it. The pathologist can find it. And certainly you can do slaughter check. If they have late infection, you can do slaughter check to understand maybe how severe is it, how many pigs have it, how bad are those lung lesions. Those are all different avenues you can use. You might not be able to use all of them, but they're different avenues you can use in order to understand, is it there, is it causing disease? So if you know you have it, then you have to figure out when you're having it. So you can do cross-sectional serology, either with the DACO or the ELISA, and you can use any previous diagnostics or knowledge of the system history to know when those pigs are getting exposed to mycoplasma, to answer that question. And finally, with PRRS, is the vaccination program needed, and is it appropriate for this situation? So is the program needed? Do those pigs get exposed to PRRS? So that's pretty easy. I look first in grow finish. Are those pigs exposed to PRRS? We could do some cross-sectional serology, understand if they go positive. Certainly if you have a history of positives or they're going into a positive site, you have diagnostics from past groups that would always break in that site. You kind of use your whole clinical knowledge of sites or flows of pigs. So stepping back from grow finish, now we can determine maybe those pigs are exposed at weaning. Are they exposed at weaning? How do we know? We can bleed due to wean pigs or newly weaned pigs. And typically we would bleed 30 head and we'd pool them by 5. We'd probably do it twice, at least a week apart, and try to understand what's the prevalence. Do we have a whole lot of positive pigs at weaning, or do we only have a couple positive pigs at weaning? And that's where this 5-step, or this different 5 profiles come in, or the PRRS vaccination recommendation chart comes in. And so, as I said, we go down the grow finish list to say, do they see PRRS in grow finish? And then then we go down the tested at weaning list, and if they're negative at weaning, they fall into these bottom 4 categories, versus if they're positive at weaning, they're in the top category. So we use this to help categorize those herds to understand, is vaccination going to be appropriate for all of these different situations? And finally, sow herd status. We all have to take into consideration the sow herd status, as it has so much impact on the pig. The last portion of this section is understanding the current constraints. And so with PRRS, it makes really a lot of sense to understand current constraints. Do you have a lot of maybe area spread? Is there a lot of other things going on? So this is a Google map that I used, and it's got sites, and the yellow rings are within a mile, the orange rings are 3 miles, and the blue rings are 5 miles. And you can see there's a lot of sites and there's a lot of density right there. Certainly there's lateral risk to infection in this case. But other things that could contribute to an appropriate vaccination program is maybe you have a flu break in the sow herd and the pigs are very sick at weaning. That might not be the best time to vaccinate if the pigs aren't healthy. You might have some husbandry or management practices that might change how you would vaccinate. For instance, if you had pigs going into a continuous flow nursery, or you had pigs that will go into a continuous flow nursery on site with a farrowing barn. Maybe the sows are negative, but the pigs are going to be exposed to PRRS later, but maybe that the timing doesn't quite work out right. It's taking all of those things in every system, and every system is very different, but it's taking it all into context in order to develop a program. The second portion, or the second question, is the vaccination program being implemented as you intended? So how do we go every day and inspect what we expect people to do? You know, we don't just hand them the bottle of vaccine and say, okay, go vaccinate these pigs every day.